Hello and welcome to this point of view breakdown of a femoral neck fracture surgery. Once the patient is positioned and draped, we bring in the C-arm, an intraoperative X-ray machine, to mark out the fracture site and important anatomy landmarks. This ensures that we make our incision and dissection in the right location for hardware implantation. Using an electrocautery knife, we begin this dissection down to the femur. Once down to bone, we position a pin guide along the bone and check its location using the C-arm. If the position is satisfactory, we insert a pin through this guide and into the femoral neck and head. It is crucial to stay on the lower aspect of the femoral neck for best and strongest fixation. With the pin in place, we remove the guide and use a depth gauge to measure the length of the pin inside the bone.
So I am right to the subcortical bone. You have to obviously go shorter than that. That says what? 93?
With the length known, we set a reaming drill bit to that size and create an opening directly over the pin. Once the reaming is complete, we insert a combined bolt and plate directly over the pin and into this opening with a mallet. This hardware is connected to a targeting insertion device which helps with the placement of further fixation. Using the proximal targeter, we drill through the bone and plate to place a screw. In a similar fashion as before, we drill and measure the length of the bone and insert the appropriately sized screw.
Um, 40's right there, we're at 40.
40?
Once this is completed, we drill through the most distal guide to place an anti-rotation screw up into the femoral head. Since we already know the length of the bolt, we set the drill to the same length. We can then insert a locking screw to complete the fixation using the Femoral Neck System. With all the hardware implanted, we can remove the insertion guide and proceed with one final phase of fixation. The goal of this surgery is to provide stability to the femoral neck fracture. While the Synthes FNS provides robust strength to the fracture zone, we like to place an additional cannulated screw just above to really fill up the neck for stability. Make sure to check out our previous video about hip pinning, as that describes in detail this process of cannulated screw fixation. Once it is positioned correctly, we measure the length of the pin and insert the screw directly over it to complete the implantation of all hardware and achieve our goal of effectively filling up the femoral neck to stabilize the femoral neck fracture. With the fixation complete, we move on to the final phase of surgery, which is to close the incision. We first irrigate the wound with sterile saline to flush out any debris to minimize infection risks. We then use a strong dissolvable suture to close the deepest layers of tissue. This helps to prevent hematoma formation. Once the deepest layer is closed, we move to the subcutaneous tissue to close that with an additional layer of suture. The most superficial skin is then closed with staples. These staples will be removed in clinic in 2 to 3 weeks. They will work closely with physical and occupational therapy teams to regain their strength and mobility. Thank you for joining us on this surgical walkthrough for femoral neck fractures using the Synthes Femoral Neck System. Make sure to subscribe for more point-of-view insights into the orthopedic trauma OR.